Hello, we shall discuss on the topic cancer. What is cancer? Cancer is defined as uncontrolled growth of tissues without differentiation. Differentiation means cell becoming specialized to perform specific function. If we compare plant cells like xylem and phloem, xylem specialized to conduct water and minerals, and phloem cells specialized to conduct food. So this specialization is referred to as differentiation. So in the body of the living organisms, cell divide to increase the number and size of the body. The cell differentiate to perform specific functions in the body. However, sometimes the cell divide continuously but fail to differentiate, and this form a mass of cell due to the uncontrolled mitotic divisions. So this mass of cell is called as tumor or neoplasm. That means the mass of undifferentiated cell that is formed by mitotic cell divisions is called as the tumor or neoplasm. Tumor are of two types. The first type is the benign tumor, and the second type is the malignant tumor. Now let's first discuss on the benign tumors. These tumors are non-malignant, that means non-cancerous, and they remain confined in its original location, and they do not spread to other parts of the body. The cells of this tumor, that is benign tumors, stop increasing in size after certain growth and is unable to infiltrate into the nearby tissues. Some of the example of these benign tumors are skin wart. Now let's discuss on the second types of tumor, that is malignant tumor. The cell of the malignant tumors are the actual cancerous cells. These cells, that is the cell of the malignant tumors, grows rapidly and spread to nearby tissues or cells where they form secondary malignant growth. So this spread of cancerous cells from its original location to other parts of the tissue is called as the metastasis. So metastasis is the property of the cancerous cell to migrate from the original location to other part of the body. So this metastasis result in secondary growth, and the cell that arise from the carried away malignant cells are called as the metaplastic cancer or secondary cancer. Now let's discuss on the types of cancer. Cancers are named on the basis of the tissues in which they develop. The first type is sarcomas. Sarcomas are cancerous or malignant growth arising in the tissues that is derived from the embryonic mesoderm. So some of the example of these sarcomas are cancer of bones, muscle, lymph nodes, and even the connective tissue. So the cancer of these tissues are called as the sarcomas. The second type of cancer is the carcinoma. Carcinoma are the cancerous or malignant growth of the epithelial cell of the tissues. So the tissues that is lining the body is called as the epithelial tissues. So the cancer of this, the cancer that is arising from these epithelial tissues are called as the carcinomas. So some of the example of carcinomas are cancer of skin, lungs, breast, and even stomach and the pancreas. The third type of cancer is the melanomas. These are the tumors that arise from the melanocytes cells of the skin and other organ. Melanocyte here refers to the cells of the melanin. So some of the example of melanomas are mucosal melanoma, superficial melanoma. The fourth type of carcinoma, fourth type of cancer is the leukemias and the lymphomas. Leukemias are cancers of the hemopoietic cell. Hemopoietic here refers to the blood cells. So in leukemia, the number of white blood cell increases considerably. So this abnormal increase in the number of blood cell is also called as leukemia, and this leukemia is also called as the blood cancer. In case of lymphomas, there is excessive growth of lymph nodes, spleens, and other lymphoid tissues. So this is these are some of different types of cancer. Now let's discuss on the symptoms or warning signal of cancer. The first symptoms or warning signal includes the presence of persistent tumor on the lips, tongue, and even breast. Second is the rapid change in the appearance, form, and growth of the skin wart of the body. The third is the persistent hoarseness of voice, coughing, or difficulty in swallowing, indicating the chances of throat cancer. The fourth is that any wounds with continuous bleeding or not healing for a long period. This also is a sign of cancer. And the fifth one is the continuous loss in weight. So these are some of the few symptoms or warning signals of cancer. Now let's discuss on the causes of cancer. Cancer is caused by a variety of reasons. Now the first let's discuss on few causes. The first one is smoking of tobacco may cause lungs cancer, even cancer of mouth, throat, and larynx. Chewing of tobacco and betel nuts causes irritation on the buccal epithelium and result in mouth cancer. The third is there are certain number of chemicals which can also induce cancer in the body. So these chemicals include nicotine, caffeine, coal, and even oil combustion products. Even the pesticides, aerosols in the nickel manufacturing units may cause cancer for the workers who are working in these manufacturing industries. Now, exposure to radiations like UV rays also induces cancer, and even the incidence of leukemia, that is blood cancer, is more in radiologists. Radiologists are those persons who are working on who are most of the time working on the x-rays, so they are most of the time exposing to x-rays. So this percentage radiologists, they are more they have high chances of leukemia, that is the blood cancer. Now there are also certain biological agents like viruses and even the pathogens that are responsible for causing cancer in humans. So these are some of the few causes that may induce cancer in the body. Now let's discuss on the treatments of cancer. The common approaches for the treatment of cancers are, the first one is surgery. Surgery involves the removal of the entire cancerous tissue from the body, and this surgery is the easiest method of cancer treatment, but this surgery is not employed against all the type of cancer. The second is chemotherapy. Chemotherapy involves the use of drugs called as the chemotherapeutic drugs that are used to kill cancerous cells. Some of these chemotherapeutic drugs are specific for particular tumors, and majority of these chemotherapeutic drugs have side effects like hair loss and even anemia, and may even cause anemia. The third is the radiotherapy. Radiotherapy involves the exposure of tumor to the ionizing radiation like the X-rays, which kill the cancerous cells. So radiation therapy is employed in around 80% of the cancer patients. This radiotherapy also gives good results to the cancer on lips, to the cancer that is arising on the skin, lips, mouth, and even the cursival cancer. The next treatment is the hormonal therapy. In this hormonal therapy, the hormone that causes cancer is treated by another hormone which neutralizes the carcinogenic hormone. Carcinogenic here refers to the hormone that is causing cancer. So in hormonal therapy, the hormone that is causing or inducing cancer is being treated with some other type of hormones that can neutralize its carcinogenic activity. So example, breast cancer is a hormonal cancer, and it can be treated by treatment with hormone like testosterone. So this is all about the treatments of cancer. Now we shall discuss on how the cancerous cell is different from the normal cell. Normal cells have a definite lifespan, and they are replaced by new cells that is formed by mitotic cell division and cell differentiation. In normal cells, the cell divide and differentiate the cell division and cell differentiation are highly regulated, and therefore the number of cells in the tissues and organs remain almost the same. They also remain always in contact with each other. That means normal cells are always in contact with each other, and they keep check of uncontrolled growth. So when they remain in contact with each other, this contact of one cell with other cell check the uncontrolled growth of cell. So this property whereby the cell remain always in contact with each other and keep check of each other uncontrolled growth is called as contact or cell inhibition. Contact inhibition or cell inhibition. So in normal cells, contact inhibition or cell inhibition are found, but in the cancerous cell, cell inhibition or contact inhibition is absent, and the cell develop the ability to undergo uncontrolled divisions, forming a mass of undifferentiated cells called as the neoplasm or tumors. So due to the absence of this contact inhibition or cell inhibition, these tumor cells can divide uncontrollably. That means they can divide and form a mass of cell. So due to these reasons, that means due to lack of these contact inhibitions, the undifferentiated mass of cells are formed in some of the cell division, and this gives rise to tumors.